Hi, I'm Helen McAteer, and today I'm joined by Professor Catherine Smith and Dr. Satveer Mahil from the St John's Institute of Dermatology in London, who are the principal investigators on PsoProtect and PsoProtectMe. So if you could remind us, maybe Catherine, what are PsoProtect and PsoProtectMe?
Yeah, well, these are two global online registries that we set up back about a year ago to try and better understand the impact of COVID-19 in people with psoriasis. And there are two, one for doctors and nurses, PsoProtect, which is to report details of their patients with psoriasis who develop COVID. And the main aim of that study is to understand the course of COVID in people with psoriasis and identify risk factors that might mean that they are more at risk of severe infection, particularly infection that requires people to go to hospital. And then the second one is PsoProtectMe, which is the online registry for people with psoriasis. And in that registry, we were interested in hearing from people with psoriasis, both those who had and those who had not had COVID, just to really ask individuals to report their experiences of living in the pandemic. And that, as I say, is called PsoProtectMe. And actually, just to say, we still do really want to hear from people. So that's a plug. Please do keep reporting at psoprotectme.org.
That's great. And those links to PsoProtect and PsoProtectMe can also be found on the Psoriasis Association website. So it's been great that both projects have received so much data, with over 3,600 responses for the PsoProtectMe survey and over 1,000 cases for PsoProtect. So can you share any of the results so far?
Thanks, Helen. Yes, we're really delighted to be able to share the results. So, as you said, we've had such a great response to our surveys, and we've already learnt a lot about how the pandemic has affected people with psoriasis. So, firstly, to mention the findings from PsoProtect. So that's information that doctors and nurses have submitted on individuals under their care who have psoriasis and COVID. We discovered that people with psoriasis are actually no different from the general population in terms of their risk factors for becoming severely ill with COVID. So in other words, people with psoriasis were more likely to be admitted to hospital with COVID if they were older, male, of non-white ethnicity, and with other health problems such as lung disease. We also found that most people taking drugs that affect the immune system for their psoriasis, whether that's biologic injections or traditional immunosuppressants such as methotrexate or cyclosporin, they made a full recovery from COVID. And this was really very reassuring to know. So at the beginning of the pandemic, we had no information about what effect these sorts of treatments might have on the course of COVID. So the data that we've collected through PsoProtect has been really very informative for us.
That's really good to hear. Is there any information yet about whether some of the drugs might be safer than others?
Oh, Helen, that's such an important question. We get asked that all the time by our patients, and actually to answer that question precisely, we actually need even more. We need a lot more data, and that's actually why we've used the data from PsoProtect and are collaborating with other specialties that use those same drugs that we are using to try and ask that really specific question. But in the meantime, we did have enough information from PsoProtect to just ask quite a crude question, really. Is there a difference in risk of being in hospital between people taking a biologic compared to people taking so-called traditional immunosuppressants? So we had to lump quite a lot of different drugs together, which isn't ideal. So we put methotrexate and cyclosporin into that same group of so-called traditional immunosuppressants. And what we found was that people who were taking biologics, so that's any biologic, again, we had to lump them all together, were less frequently in hospital with COVID compared to those on traditional immunosuppressants, such as methotrexate and cyclosporin. But that doesn't necessarily mean that biologics are safer.
Well, why not?
Well, because all we found was an association. So we found that people taking biologics, there was an association, but we don't know if this association is causal. So that there may be another explanation for our findings. So for example, when we looked at the PsoProtectMe registry data, that data suggested that people on biologics are shielding more than people on traditional immunosuppressants. So that might be the reason we saw the difference was, well, people on biologics were more stringently shielding, they were less exposed to the virus, they had less of a viral burden. And that's why we found that report, we found in the data that those people taking biologics seem to be better off. I don't know whether, Satveer, you want to say a little bit more about those PsoProtectMe findings.
Yeah, sure. Thanks, Catherine. So from PsoProtectMe, we looked at information from 3,720 people, of whom the majority, so 2,869, had psoriasis. Also in this pool of data, we had information from a partner registry called Core UK, and Core UK is a survey that people with joint conditions can answer, which is very much aligned with PsoProtectMe. So overall, looking at that pool of data, a greater proportion of people who were receiving targeted treatment, such as biologics, reported shielding, compared with those receiving either no treatment or traditional immunosuppressants, such as methotrexate. So individuals receiving the targeted treatment, so biologics, may well, as Catherine mentions, have been less exposed to the SARS-CoV-2 virus, thanks to their more strict social distancing. And this may be contributing to the overall better outcomes that we have seen reported in the registries.
So hopefully more positively, will the rollout of the COVID-19 vaccines change the focus of PsoProtectMe?
Yeah, so absolutely, Helen. It's a very positive time at the moment, and we're delighted that so many of our patients have been vaccinated already. So the focus of PsoProtectMe is still very much to improve our understanding about the behaviours and experiences of people with psoriasis during the pandemic. So actually, the rollout of the COVID vaccine is a really important consideration at the current time. So we are at the moment in the process of adding extra questions to PsoProtectMe, and we hope with these extra questions we want to explore the uptake of the vaccine, and we'll also be exploring patient perceptions of the risks associated with systemic treatments for psoriasis, and also access to healthcare during the pandemic. And with this, we're aiming to really gain even deeper insights into some of the findings that have emerged from the study so far, and that you've already heard about in today's interview.
So how can people take part in PsoProtect or PsoProtectMe if they haven't already?
So please do take part. So if you have psoriasis, you can complete the PsoProtectMe survey online, and you just go to PsoProtectMe.org. The survey takes 5 to 10 minutes, and we hope today that we've really demonstrated just how important and valuable your contributions are, as we can learn so much from your personal experiences, which ultimately will help inform clinical practice. And to doctors and nurses, please visit soprotect.org, and there you can enter anonymised information on your patients with psoriasis and confirmed or suspected COVID. So we really hope for ongoing robust participation from healthcare professionals and from patients, as we've seen over the past year. And this will really help to ensure that our findings remain generalisable to the global population of people living with psoriasis.